Hello, everyone. My name is Natalie Alvarez, and I will be talking about the effects of cancer on a family. So, first of all, what is cancer? Cancer is a name used for a large group of related diseases. It is a genetic disease caused by changes to the genes that control how our cells develop and multiply. Each patient's cancer contains a unique set of genetic changes, which is why we see there are more than 100 types of cancer that exist. According to the National Cancer Institute, there will be over 1,600,000 new cases of cancer in 2016 alone, and over 590,000 of those people will not survive. Cancer is a family disease that does not only affect the patient, but the entire family as well, especially children and adolescents. The family bears the impact of the disease, and it can create major changes in living patterns, roles, and relationships. So, I'm going to start off by talking about the effects on the patient themselves. Parents with cancer very often experience significant parental stress, which can lead to depression. The diagnosed parent can also experience tremendous guilt due to not being able to provide good parenting, physically and psychologically, for their children. The diagnosed parent going through treatments can also lead to a lack of concentration, ability to think clearly, retain information, and make decisions. They can also experience things like mood swings, anger, and anxiety. Some physical effects are loss of appetite or overeating, loss of sleep, or lack of concentration and ability to think clearly. Um, all these effects can change depending on the course of the parent's disease. So, if it's at the beginning, right after the diagnosis, or if the cancer is advanced, these symptoms will also change. So, the effects on the spouse. Majority of the time, the spouse is also the main caregiver. The role of both parents after a cancer diagnosis is very important. Families are affected not just by the ill parent who will now be more absent, but also by the well parent as well. The well parent is faced with an array of challenges that can include increased responsibilities at home, caregiving for the ill spouse, as well as taking care of financial burdens of the family. The well parents will also face their own feelings of depression, anxiety, and distress. The spouse will often place the needs of the patient above their own, and as a result, they spend less time maintaining their own physical, mental, and social health. Also, parenting itself can be overwhelming and consuming role under the best of life circumstances. But when the family is strained by the burdens of an illness, the caretaking parent can feel that they are unable to provide time and consistent parenting for their children. When a parent is diagnosed, one of the first big issues is telling the children about this. It can be a very heavy burden on the parents trying to decide on how to tell them when, and if one at a time or to all the children at the same time. This can be difficult to decide when the children's ages are very spread apart. Many parents experience a lack of confidence and skills as they consider communicating with their children about cancer. Parents also feel the need for professional help in the area of communication and also on how to deal with changes in their children's behavior. Some emotional effects on the spouse can be physically and mentally draining to them as it becomes as like they are parenting by themselves. Mood disturbances because of all the stress with everything going on, and high levels of distress. Effects on the children. So, depending on the child's age at the time of diagnosis, changes the way that anxiety and emotional distress are expressed. Preschool age children are at a higher risk of experiencing separation anxiety, depression, and disruptions in their attachments in response to changes in caretaker responsibilities. When substantial changes are made in who cares for them, it can be very difficult for a child to adapt because this takes them out of their routine. School age children and adolescents are more likely to experience feelings of hopelessness. They're also more likely to experience more of a burden by guilt or and anger over the diagnosis as well as emotional isolation. However, it is also important to know that each child and case is different and there can be multiple variables that play into a child's reaction. Any individual child can experience a variety of emotions and feelings which can also change over time, depending on what happens with the parent's illness. Some children can also internalize their anxiety and depression, which can go uncovered without substantially more parent child interaction and discussion. Anxiety levels can also be affected by how or whether they were told by their parents about their parents' cancer. Well informed children experience less anxiety and have improved coping strategies. Effects on the family as a whole. Once a parent is diagnosed, the foundation of a family gets shaken. Each family is unique. It is important for a family to keep communication open. Children who experience open communication and sharing of information felt involved in the family situation. Open communication also created a stronger trust between the child and the parents. Not sharing and keeping the children updated can make them feel excluded, unimportant, and frightened. A parent being diagnosed can create tension within a family if open communication has not been established. Other emotions like depression, hopelessness, and confusion can also affect the whole family. Another thing that can also happen in the time of diagnosis is confusion about roles and expectations at home with the children. Now that one of their parent will be gone a lot of the time and the other one is busy caring for the sick parent, it can create a lot of changes in the usual routine for the family, and so that's where all the confusion comes into play. So how are the patient and family getting cared for? In lots of cases, the children of the adults being diagnosed go as the lost voice. A number of interventions have been created, however, their focus is on the parents. Few interventions focus on the parents and children, but even fewer of those have made it to publication. So why is this important? This is important because fewer of those that have actually been publicized have been systematically evaluated. Just being implemented is not enough because when they're published, they get evaluated and tested to see how effective they are being. And so, them being evaluated and tested is critical to meeting the needs of patients and families' needs through this hard time. The cancer experience is powerful in families, but so too can be support and assistance. Increasing the children's knowledge and understanding of the cancer can equip them with better coping strategies and improve their moods and behaviors. Providing intervention that takes into consideration all of the family's needs would also bring a relief to the parents, knowing their children are receiving professional help and support. Professionals agreed that providing a type of intervention is vital for the family. It allows for four very important things to happen. Children and adults are able to learn about the cancer in an age appropriate way. The family gets to explore feelings and emotions related to a parent or spouse having cancer, and it reduces the feeling of isolation for everyone. So I felt a strong need to do my project on this because I experienced this personally when I lost my father, and so I did see that there was a need for family support as well and as a whole, because there was a lot of support a lot for like my parents, but I didn't see that for the family, and so I really wanted to research into this topic. and it did reaffirm the need for interventions that take into consideration each set of families' unique situations and everyone involved. These are a few of my references and sources that I use to